Doctors are starting to see some of the so-called collateral damage of COVID-19, with patients now showing up with diseases such as cancer in more advanced stages. Well, a lack of in-person health care over the course of the pandemic also has pharmacists sounding the alarm over a growing gap in preventative care for heart and stroke.
I think we all know that there's been some consequences to the pandemic, wait lists, surgeries, cancer diagnosis, but one that we think that not many people are talking about is the impact of chronic disease.
Shoppers Drug Mart is noting a 30% decrease in new prescriptions for high blood pressure medication, with new data suggesting nearly 1 in 5 expected hypertension patients are either not seeking treatment or unaware they have it. If left untreated, high blood pressure can lead to heart attack, stroke, and kidney failure.
It is one of the number one risk factors for stroke, and it is a significant controllable risk factor for heart disease. If we look at actively treating hypertension or high blood pressure, we can reduce the incidence of stroke by about 35 to 40%. So, which is an incredible impact. As we all know, a stroke can be very debilitating, if not fatal. And then about 8 to 14% reduction in heart disease or coronary artery disease impact if we are also actively treating hypertension.
Another reason why this is so concerning is that pandemic lifestyle changes like less movement, more stress, more eating, and more alcohol consumption should be driving up the number of patients. In many cases, hypertension is discovered during checkups for something else. And according to shoppers, in-person physician visits have decreased by up to 79% since the pandemic began. For months now, though, the Ministry of Health has been encouraging primary care providers to resume in-person visits based on clinical need and patient preference.